And today I'll be addressing acid reflux disease, also known as GERD. So acid reflux is when acidic content from the stomach flows back into the tube that connects the mouth to the stomach. Normally, in a normal patient, when we eat, food's supposed to go through that pipe, called food pipe, esophagus, to the stomach to be properly digested. But when you have this disease, food and stomach acid tends to flow back into that pipe, which can cause a lot of discomfort and pain. So what makes food that one has eaten to come back through that pipe, esophagus? Normally, there's a muscle, we call it protective ring of muscle fibers, that is connected from the esophagus to the stomach. This ring is supposed to tighten the end of esophagus that connects to the stomach so that when you eat, food can properly stay inside the stomach and be properly digested. But you're having this disease because that muscle tends to be weak. And because it's weak, it doesn't close properly, which allows stomach acid and food from the stomach to always flush back to the esophagus. Okay, I will ask, what makes this muscle to be weak? This muscle can be weak due to excessive smoking. Have you been smoking? It can weaken that muscle. Pregnancy can equally weaken that muscle. Type of food do you eat? Are you eating a lot of spicy food? Are you always on chocolates? Are you always drinking carbonated drinks? A lot of acidic food can weaken that muscle as well. Some certain condition like hernia can also weaken that muscle. Drinking excessive alcohol can weaken that muscle. Okay, another question is, what can increase my risk of having this disease? Are you overweight? Being overweight can also increase that risk. Do you have a family history? Somebody in the family, they have had it before? It can also increase your risk. What do you normally eat? Do you eat a lot of spicy food? It can increase the risk as well. Having some certain type of connective tissue disease, example, some rheumatoid arthritis or lupus, can increase the risk. Are you always on pain medication? Like we call it NSAID, non-steroidal anti-inflammatory drug. It can also increase that risk. How do you normally lie down when you sleep? Are you always lying on the back? It can always increase the risk. So what are the symptoms that I will see that will make me know that I have this disease? Are you always having a heartburn? When you finish eating, you will be having chest pain. Your chest will be burning. Okay, especially on the upper top of your stomach. Then you might be having acid reflux disease. Are you always having difficulty or painful swallowing? Or having excessive cough, especially at night, producing a lot of saliva? It can also be a sign or symptom. When you finish eating, you feel like your food is hanging up here, indigestion. You feel bloated all the time. It can also be a symptom. Do you always feel some acidic content in your mouth? You feel like something bitter is coming back into your mouth. It's a sign. It's a sign. Are you always burping after you finish eating? It's also a sign. Okay? So watch out all these signs because they are the signs of acidic reflux disease. What are the consequences? What are the consequences if I don't treat this disease? If you don't treat it, it can decrease one's quality of life because of a lot of discomfort and pain. It can also lead to what we call esophageal erosion, ulcer of the esophagus. It can lead to the inflammation of that food pipe, esophagitis, and it can lead to bleeding. It's not good. It can cause abnormal cell growth on the esophagus, the lining of the esophagus, which can lead to the cancer of the esophagus. You don't want that. What can I do to modify my lifestyle so I don't develop this disease? Or if I have developed it, what can I do to adjust myself so that it doesn't get worse? If you are overweight, try to lose weight. If you've been smoking excessively, stop smoking. Have you been drinking a lot of alcohol, carbonated drinks, energy drinks? You might want to limit it. Do you eat a high content of fatty meal 2 to 3 hours of bedtime? You might want to stop it because it's not good. Do you always exercise after eating? You might want to stop that as well. What portion of food do you eat? Do you eat a lot of food at once? How do you chew your food? Try to chew your food very well before you swallow it. And eat little at a time. It can help you to modify your lifestyle. Have you been eating excessive spicy food? I know we Africans, we like spicy food. But when you know the consequences of eating a lot of spicy food, you might want to stop it because it's not good for your food pipe, the esophagus. Okay, my people, I'm just here to create an awareness to help you guys to know the signs and symptoms of acid reflux disease and the consequences in case if it's not being treated. So we have some medications that can be used to treat it, but I will recommend that you go see your doctor because it's going to depend on your history or what you are going through. So they can be able to examine you very well. So this is just to create an awareness, my people. Remember, health is wealth and prevention is better than cure. Thank you for watching my video. And once again, if you love what I'm doing, please share this video because you never know who you can save out there. Thank you so much and have a blessed day. Bye.